Dr. Rapaport, finally quit raining.
It never rains in California. Where do you get that from? I'm teasing. We've had a huge rain and snowfall.
Did you see that the snow is over the top of the ski lift tower at Bear Mountain? They can't use the ski lifts because it's snow. They're under the snow. The whole thing.
I think it's near 300% of the pack, of what the pack should be.
That's some good news.
So we're okay.
So it's kind of indirectly related. One of our viewers who is in the midst of topical steroid withdrawal is on cyclosporine, is going to take an airplane ride, and was inquiring whether marijuana gummies are okay whilst on a course of cyclosporine.
They think of everything, don't they?
It's incredible.
Incredible. There was somebody who also asked, does it bother Lyme disease? That was in one of the editions also. As best we know, nothing has anything to do with anything with the drug. Cyclosporine is not ruined or dissipated or eaten up by any other medicines. There seems to be no interplay. There might be some data in the literature, and the pharmacies have it, but it's so minuscule and minor that it's not clinically apparent or even needs to be talked about.
What about birth control?
There is absolutely no contraindication with the pill. I have taken care of 5 ladies who were pregnant and stayed on the cyclosporine. I wasn't happy. I was worried. None of them had difficulty. They got through it. I'm sure there are transplant people who get pregnant and they're still on the drug. So our worries are prudent, and they should be. And until we get enough cases under our belt, we don't know the answer. So we're wary and we're very careful. But so far, I have to be in the positive realm that no, it's okay. It's okay.
Well, alcohol is certainly one that becomes a little bit self-alarming when someone's in topical steroid withdrawal, correct? I mean, just the vasodilator.
Well, there are people who have a glass of wine, they get a little flush in the face. It's genetic. But it doesn't affect the steroid withdrawal. They might be a little redder, or their face flushes more.
A little redder. If you're flaking and living in the bathtub, you don't want to be a little redder, do you?
Well, it's very hard to get an accurate history because patients will say, I drank and I got red.
Right.
And you say, well, when did you drink? Oh, last night. Well, what time is it now? It's 4 p.m. You're going to tell me from almost 18 hours before? And then the next guy says, I had a drink at dinner time and I'm sitting at the table and my face got red. I say, well, that fits time-wise. So it's very hard to get an accurate history often. And if one thing leads to the other, there's been so much written about that in magazines like the Skeptical Inquirer, where patients invariably will blame X causing Y when it has nothing to do with it.
Well, maybe this is anecdotal, but I'm under the impression that alcohol consumption for people who are topically steroid addicted and getting red versus someone that's through topical steroid withdrawal, they no longer really have that reaction. Do you share that opinion? I'm just repeating this anecdotally from what I've heard.
Again, it's very difficult to separate out the do-gooders out there. If this was the 1500s, they would say you didn't go to church on Sunday, that's why you're being punished and you're having flares.
You didn't tithe properly.
Right. So I really don't like alcoholism. I really don't like meat eaters either.
No,
I don't like this.
Right.
I don't like that. You better stop those things. Those are causing your trouble. And the patient says, well, where did you get that from? I read it somewhere. I know it for a fact. We don't know these things as facts at all. So somebody's capacity for 3 glasses of wine is perfectly fine. The next guy's capacity is 1 glass, et cetera, et cetera. So blanketly chiding them and saying they're doing evil deeds is inappropriate.
Fantastic.
No scientific data.
Fantastic. That's good. Please like, share, subscribe. Thank you very much.